Hi, my name is Aaliyah Parker, and this is Mr. Anthony Parker. And today I'm going to be performing a neurological assessment on Mr. Anthony Parker. So I'm going to begin by introducing myself and asking, Anthony, is it okay if we do this assessment today and film you?
Yes.
Okay. Also, while I'm introducing myself, I want to go ahead and check his cognition by asking him things like, can you tell me what your date of birth is?
Yes.
What is it?
2/12/72.
Good. And also, what year is it?
2024.
Who's the president?
Joe Biden.
Well, yes. Who's our new upcoming president?
President Donald J. Trump.
Yes. Now, while I'm asking him these questions, I'm also going to be noting his general appearance, how he formulates a sentence, the context of his sentence, and the logical reasoning that he uses. If deemed necessary, you could move forward with doing a mini mental exam. For now, we're going to move on to assessing his cranial nerves. Starting with cranial nerve 1, we'll be checking his smell in each nostril. So I'm going to ask him to shut his eyes and to close his left nostril, checking his right, and to smell that. Do you know that smell?
I do.
Okay, what is it?
Clove.
Good. Now, can you shut the other nostril, the right nostril, and breathe in through your left nostril? And do you recognize that smell?
I do.
Good. What is it?
Clove.
Very good. Now we're going to move to checking his visual acuity. So I'm going to ask the patient to keep looking at my nose. I'm going to try and stand more in front of him, but not block the camera. And ask him to look at my nose. And don't stop looking at my nose, but tell me how many fingers I'm holding up.
2.
Look at my nose. Don't stop looking at my nose.
2.
Good. Keep going.
3.
Good. Keep going.
4.
Keep going.
2.
Keep going.
3. 4.
Very good. And you can look forward. You did great. We're also going to check cranial nerves 3, 4, and 6. And this is going to be using those same cardinal gaze areas, but we are going to be checking to make sure that he can actually follow along with my finger movement. All right, so I want you to follow my fingers with your eyes, but keep your head straight, okay? Good, 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 good. So he performed that correctly, so we can move on to checking cranial nerve 5. And we're going to be using something that is sharp and then something that is soft, like a cotton tip. And we're going to be assessing to see if he can feel the difference in sensation on his forehead, his cheek, and his jaw. Okay. What does that feel like?
Feels like you're touching my forehead.
What's the sensation? Is it sharp or soft?
Sharp.
Okay, how about now?
Sharp.
Good, how about now?
Soft.
Good, how about now?
Sharp.
Good, how about now?
Soft.
How about now?
Soft.
How about now?
Soft.
Okay, and we would have done that actually with his eyes closed, but I just forgot to tell Mr. Parker to shut his eyes. Now we're gonna move to cranial nerve number 7. And before we check that, we're gonna be asking him some questions, assessing, have you had any vertigo, any nausea, any anxiety?
No.
Okay. And then we're gonna do a whisper test where I'll be saying something in his ear, in each ear, and asking him to repeat it. Can you please repeat it?
99.
Good. That is what I said, so he's hearing well.
99.
Thank you. That's showing us that cranial nerve 7 is intact. We're going to move on to cranial nerve number 8. Or sorry, that was number 8. We're going to move on to cranial nerve number 9 and 10. And we're going to be asking the patient to open his mouth and say ah. And we're going to be watching the palatal patch. Can you open your mouth and say ah?
Ah.
All right. And then we're going to be checking for a gag reflex and evaluate speech articulation and any hoarseness while he was saying that ah. We're also going to see if he can swallow a small amount of water. So I'm gonna just check your gag reflex. If you can open your mouth, go stick your tongue out. Very good. And keep your mouth open. And his gag reflex is intact. We're gonna go ahead and move to the water. Can you please take a few small sips? We're gonna see if he can maintain his own airway by taking these small sips, just small, and observe if he has any extra secretions coming out of his mouth or if there's any choking. And there is not, so that is good. We're gonna move on to cranial nerve 11. And with this, we're gonna be examining his sternocleidomastoid, mastoid, and trapezius muscle. And we're gonna be looking for asymmetry. And we're also gonna be asking him to push slightly against our hand and try and turn against it. Turn your head to the right. Good. All right, do it again. A little more. All right, then we'll check the other side. Push against my hand. Good. Good. We're going to be moving on to cranial nerve 12. We're going to be asking the patient to stick out their tongue. We're going to be checking for midline. Can you stick out your tongue? And just hold it out. It is midline. And then we're going to be asking him to push his tongue against each side of his cheek with his mouth open. And we're checking bilateral strength, which is good. You did good. You can shut your mouth then. And then we're going to ask the patient to say la, la, la over and over.
La, 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 over and over.
No, just say la, la, la.
La, la, la.
Good. And that shows us that that is intact. He doesn't have any speech impairment there. Now we're going to move to checking his reflexes. We're going to check his upper and lower extremities. On the upper, we're going to be checking his biceps, his triceps, and his brachioradialis. So for brachioradialis, I'm just going to have you rest your arm there. Good, good. And then I'm going to be checking his bicep. Just relax your arm. Good. And his tricep. And I'll do the same thing. I'll do the same thing on the other side. Okay, thank you. We're going to move to his lower extremities. So we're going to check his patellar, his Achilles, and then we're going to check some reflexes that should be negative. So for his Achilles, I'm going to come down here, and he's just going to dangle his foot. I don't know if the camera can kind of see. And we're just going to move this up here. Probably should take your sock off. Oh, sorry. Good. And then we're going to move to the patellar. Okay, good. After that, we're going to move to the Babinski and the clonus. And but for doing that, I will actually have you move this a little bit. I'm going to have you have your foot dangle really good. And then, well, actually, I'll lift it up like this to show the Babinski. So that is negative. And you can also do that with this if you like. And in an infant, those toes would fan out, but we expect them to lose that sensation as they go into adulthood. And then I'm going to check your clonus. So for clonus, I'm going to actually lift his leg up a little bit, and I'm going to dorsiflex it. And then if it was positive, he would have some uncontrollable shaking, but it is negative, and both of those things should be negative, so that is good. We're going to move on to sensation. We're going to do his upper extremities and his lower extremities, And for this, we're just gonna be using a cotton ball, and we're gonna be asking him if he can feel this or not. Can I have you go ahead and pull your pant legs up to your knee if you can?
Just one or both?
Let's do both. And ideally for this, he would be in a gown, but we don't have a gown, so we're gonna do this. And please take off your other sock. I'd also like to step back and remember that during cranial nerve 7, I forgot to check his taste, which is a part of cranial nerve 7. So I'm gonna go ahead and complete that now. This would have been after he raised his eyebrows and frowned and smiled. Let's just do that. Raise your eyebrows, frown, smile, and that's cranial nerve 7. And then I'm gonna give you something, and you tell me if it's sweet or salty. What is that?
Sweet.
Good. All right, just a little bit there. What is that?
Salty.
And he is correct. That is what it is. So now we're going to be checking his sensation on his extremities, and we're going to go proximal to distal, and you're going to tell me what that feels like and if you can feel it. You feel that?
Yes.
What's it feel like?
Soft?
Soft. Good. Okay. Do you feel this all down your arm?
Yes.
Okay. From the other side. Do you feel that? What's it feel like?
Soft.
Do you feel it going down your arm?
Yes.
All right, and we'll do your legs. Do you feel that?
Yes.
How does it feel?
Soft.
Do you feel that?
Yes.
How does that feel?
Soft.
Do you feel it all the way down?
Yes.
All right, thank you. For the next part, I'm going to go ahead and have him take his fingers and put them to his nose, and then take his other fingers and put them to his nose while putting the other one down. And then I'm going to ask him to switch back and forth rapidly. Yep, very good. Can you do it a little bit faster? Very good. Okay, now for this part, you can put your pant legs back down. I'm going to have you stand up. And I'm going to be checking his pronator drift and his gait through a couple of exercises. So you can stand up and put your palms up right in front of you, okay? And put them all the way out. I want you to shut your eyes, okay? Shut your eyes. Shut your eyes. Keep them up. Keep your palms up. Good. So he passed that. And now you can open your eyes, and we're going to try and not get out of the camera's view, but I'm going to have you do some walking. So I'm going to have you walk across the room. You can start right here where I am in front of me and turn so the camera can see you. Walk across the room and then come back to your chair and sit. Good. Go ahead and sit. And then stand back up, please. Very good. Now, I want you to do the same thing, but walk on your toes. Good. Try not to drop. Stay on your toes. And you don't have to sit, but you can come back here and turn. Now I want you to walk the same way, but on your heels. Good. Very good. All right, now you can stop there, face the camera. I want you to side step 3 times to the left. Side step. Yep. Now 3 times to the right. Okay, stop. And then I want you to hop 3 times on your left foot. Good. Now hop 3 times on your right foot. Excellent. And you can go ahead and sit down. You did a great job, Mr. Parker, and that is the conclusion of our neuro assessment.